of the NPs. I'm Shauna.
I'm Julia.
And I'm Angie.
On today's show, we're going to be discussing many of the issues that our audience has recently been emailing us about, including a disease called Parkinson's disease. Let's go ahead and get to one of these emails. Jenny from Indiana wrote, "Dear NPs, my mother was recently diagnosed with Parkinson's and I'm feeling overwhelmed by all the information I found on the internet. Please help me." Well, ladies, I know that we have all come in contact with Parkinson's disease patients, so is there any advice you would have for Jenny and our audience?
I'm so glad we are addressing this disease today. Many people have heard the term Parkinson's disease or PD, but like Jenny don't fully understand what PD is or the current treatment. I think it's important to start by giving just a little bit of basic information about PD. PD is a chronic and progressive neurological disease for which there is currently no cure. The loss of dopamine-producing brain cells can cause symptoms such as tremors, body stiffness, loss of balance and coordination, and even marked slowing in basic movement.
I'm so glad you brought up the symptoms of PD. Often in our practice, we have patients who are concerned with symptoms such as difficulty sleeping because of nighttime jerking of the extremities, and often difficulty with swallowing food. PD symptoms can definitely be challenging for our patients, and education for the patient and family is extremely important.
You're right, Julia and Shauna. When we think of disease and hear the word treatments, we often confuse the word treatment for the word cure. Although there is no cure for PD, there are many options for treatment of symptoms and the progression of the disease. One alternative therapy that you may have seen recently in the news is Coenzyme Q10.
I have been hearing a lot about CoQ10. Can you tell our audience a little bit about how this product works?
I would be happy to. Although fairly new and still being studied, one study produced out of Cornell University showed the use of CoQ10 improves the function of the mitochondria in the body's cells.
Okay, so slowing this down just a little bit for our audience today. For those of you who might not know what a mitochondria is, this is actually the area of our cells that produces energy by taking everything we eat, such as lipids and carbohydrates, and breaks it into the energy for our cells to use. Providers actually call this the powerhouse of the cells.
That's right, Shauna. In my research, I found several articles related to the effects of CoQ10. CoQ10 is a vitamin-like substance that basically helps to increase the ability of cells to make energy and helps with oxidation in the cells. The reason this is important for our PD patients is because CoQ10 has been proven in animals to increase the reperfusion of oxygen and helps to protect the functionality of the mitochondria.
That's right, Julia, and CoQ10 is also showing promise in the uses for encephalomyopathies, congestive heart failure, and diabetes. There are several subjects we will be covering later in the show. A recent study I found was a study done with 80 PD patients taking 1,200 milligrams a day of CoQ10, and they showed a 44% decrease in the rate of PD patients becoming symptomatic.
I saw that study you're talking about. The same study showed 28 patients already symptomatic with PD also demonstrated mild symptom improvement with daily dosing of 360 milligrams of CoQ10. So there is evidence that a range of this alternative therapy can have a benefit in the disease.
I would like to point out to our audience, too, that the actual recommended dosage range of CoQ10 for treatment of PD is 300 to 1,200 milligrams per day in 4 divided doses. And this is considered an alternative treatment that is not regulated by the FDA.
Oh, I'm so glad you brought that up. It is important to remember that although this alternative therapy is sold in most drugstores and in a lot of health stores without a prescription, but monitoring by a healthcare professional is advised, and especially when you're using them with prescription medications.
Great point. I feel our audience needs to know that Coenzyme Q10 does have potential side effects.
And I'm going to go ahead and have our producers put a list of those side effects and the interactions up on our screen now.
Great, let's take a minute to review these. Adverse effects are rare, but among the most common reported are GI discomfort that has been reported in less than 1% of patients in clinical trials. Interactions reported are hypoglycemia and hypotension when used with diabetic or antihypertensive medications, and potential interactions with the blood thinner Coumadin causing decreased INR.
I want to point out that the Coenzyme Q10 has not been studied in pregnant or breastfeeding women or in children, so it should be avoided in those patients until further studies support its use. Also, did either of you know that the majority of CoQ10 products are made in Japan, with research demonstrating variation in bioavailability and dosage consistency?
No, I didn't.
I have not found any information that the production might be decreasing related to the hardships in Japan, but that is another factor that we as practitioners will have to be watching.
There are also many brands available of Coenzyme Q10, and prices vary by brand. On your screen there is a list of brands that have passed independent testing for product purity and consistency. Brands used in CoQ10 studied with PD included Valentine, a chewable formation that is easier for PD patients that have trouble swallowing pills. The average monthly cost for 100 milligrams per day is $30, and the average cost of 1,200 milligrams per day is $300. The high cost of this alternative may be a deterrent for some of our patients.
I think we have shown today that CoQ10 is a safe but expensive supplement with preliminary benefits in neurology, including treating Parkinson's disease.
Well, thank you, ladies, for helping me answer Jenny's question. I'm sure our audience also has learned much today. So join us after the break. We'll be discussing why bags of Cheetos is not a good lunch.